Hello, everyone. Welcome back to the Goody Life, where life is good and everything is great. I'm Dr. Goody, and if you're new to my channel, the Goody Life is all about finding inspiration, motivation, and self growth in all different aspects and areas of your life. In this month, we're finally moving into another area. As you guys know, the Goody Life focuses on 5 areas of personal growth and development. We just finished up with relationship, and we're moving into one of my most favorite area and subject to talk about. That's health and wellness. Last year, when I did a full month on health and wellness, you guys really liked those videos. I had experts and licensed fitness instructor came in from all different parts of the world where they talk about the benefits for fitness, yoga. We had a nutritionist, someone that came in and talked about mindfulness. So all these things fall under health and wellness, taking care of your mental and physical health. And one of the things that I think you guys really liked and that I also really liked was bringing in actual expert or someone who was licensed in that field to talk about those benefits. Again, this year I'm doing the same thing. The next month is going to be all about health and wellness. However, the difference is this time, since I'm a soon-to-be mommy, it will focus around prenatal and pregnant women. I will be bringing in experts and licensed people to talk about prenatal fitness, the benefit of that, the benefit of yoga. I will have a nutritionist. And today, to start off, we're actually having a doula who would be telling us a little bit more about what a doula is and what someone goes through during pregnancy from first to third trimester. Don't click out because there might be something here for everyone to benefit from. If you are someone who is planning to get pregnant within the next year or in the future, these videos can be very beneficial, especially when I spoke to the nutritionist. You're going to see in that video, a lot of times we don't find out about the benefits of nutrition in pregnancy till way later on into the second trimester. However, nutrition should be something that was talked about and dealt with in maybe a year prior to getting pregnancy or 6 months prior to getting pregnant, because it can help prevent things such as gestational diabetes and other health issues from popping up, which is something I will be talking about in a future video all by myself and what my experience was like. But first and foremost, I like to bring in the experts to share their views and how to take care of one's health and wellness. So again, you can benefit from early on, even if you're in your first trimester, second trimester, third trimester, or post-pregnancy. All of these health and wellness videos will definitely be beneficial to you. These experts are dropping some great gems on how to take care of yourself. With that said, today I just mentioned we're going to be talking to a doula. And prior to being pregnant, I have heard of the word doula, but I wasn't really familiar with what all it encompasses and what this person do to help someone during pregnancy. And when the doula comes on, she's going to tell us a little bit about that, and she'll tell us also what are some ways to take care of yourself. So with no further ado, let me welcome Elizabeth, the doula. Hi, Elizabeth. How are you?
I'm doing great. Thank you. How are you?
Good, good. Thank you so much for joining in today for this video.
Yeah, I'm honored to be here, and I'm super excited to talk to you about all of the doula things and pregnancy stuff. It is truly a passion of mine.
Yeah, and that's what I'm so excited the most to learn about, because this month is my health and wellness month where I talk about different areas and how one can take care of themselves. And prior to getting pregnant, I was familiar with the term doula, but not quite how much that individual really plays a part in the pregnancy. So, with that kind of being said, if you don't mind telling us a little bit about yourself, your practice, maybe what got you into doula. And one of the things people always want to know is what exactly, or at least myself, what exactly is a doula and how do they help throughout like the first, second, and third trimester? What's their role in a pregnancy?
Yeah, for sure. So I became a doula because I am just really, really passionate about helping women. I realized that becoming a doula was the best way that I could help educate women, help them learn how to advocate for themselves, and to be present with them throughout labor and delivery to hopefully help prevent those things from happening. Because research shows that when a doula is present, you're 28% less likely to have a cesarean, you're way less likely to have other interventions, you're more likely to look back at your birth as a favorable experience, not something that happened to you, but something that you were a part of the decision making. You felt informed, you felt empowered during your birthing experience. So doulas provide emotional, physical, and informational support throughout labor and delivery, also during pregnancy. So the information part comes before the labor and delivery. So we partner with people to help you learn about your birthing options and to curate your birth plan, which we'll get into later, and to really help you inform and empower yourself going into the pregnancy. So we kind of serve as a guide. And then during labor and delivery, we provide that physical comfort. So there's laboring positions, there's techniques you throughout the labor, whether you're having a medicated labor or not, there's still so much physical you can do. And then emotional. Labor is an emotional roller coaster, which you're going to find out soon. It's, like it's one of the biggest life changing events of your life, bringing a life into this world. So, you overcome fear and doubt, and you have questions, and you experience pain, and all of those things are a mental battle. So having somebody who's constantly there for you, reminding you how powerful you are, and helping validate your feelings and your experience is so important. So that's what doulas do. I work currently with a practice here at a hospital. So I work with a midwife group, and there's an OB as well, and with 3 other doulas. So we take on a certain number of clients every month who are going through that midwife group, and they can sign up for our doula program. So I'm on call certain days. And if they go into labor on one of my call days, then I'll be the doula that's called in for that birth. So most doulas work on call all the time. Right now, I have a 7-month-old at home, so it's really nice to be able to have a schedule. But yeah, I'll probably go back to a private practice once I'm done having kids and once they're a little bit older.
Yeah, wow. That's a lot of information. It clearly shows that, as a doula, you play a big part in someone's pregnancy journey. And it's not just the part that you play, but the empowerment around it. Like you said, there is a lot of anxiety, there is a lot of fear, uncertainty when it comes to just that mom being pregnant, going through her hormones and everything. So having someone and having someone with the right kind of information. And we will get into that a little bit more of where information come in from in a bit. But that's one of the things I think it's important to have someone who actually have the knowledge. And like you said, you guys really study the labor process and the pregnancy journey. And that's where your knowledge come in to help someone who's going through a pregnancy.
Absolutely.
Kind of moving in right into the first, second, and third trimester. I don't know if this is a question you get asked a lot from mommies, like someone who's trying to get pregnant or already right into that first trimester. Like, what are some things one can expect throughout each of those trimester and their journey? Because, for example, I was not very familiar with being ill in my first trimester. No one mentioned that there is such a thing that I always thought, oh, you'll have a 1 or 2 day throwing up and then you go on with your day. For me, I was actually out for weeks I was in my bed. I was all day sickness. So these are things I think sometime before someone get pregnant or they're trying to get pregnant or even right in that beginning phase, just knowing what to expect. So what are some of the things mom should expect during a first, second, and third trimester?
Hmm. That's a great question. And all of these are going to be generalized answers because everybody's experience is so different. So there's some people that experience the extreme morning sickness in the first trimester, which, by the way, is not in the morning, it's all day. I don't know who called it morning sickness because it's all day. So you can have it at any time. And some people don't. And there's people who have hyperemesis, which is where they have the extreme sickness throughout their entire pregnancy, where they even have to be hospitalized. So everybody's experience is going to be really different. But typically in the first trimester, you're getting this surge of hormones that your body is not used to. And everybody is going to handle that differently. There are a few things that you can do to help, which we'll get into a little bit. But for the most part, there's so much that is out of your control. So in the first trimester, you have this surge of hormones going, right? So much is changing. That little tiny embryo is like quadrupling like every day basically. And so things that you're going to experience are nausea. You're going to experience different things with your body. Some people get like constipation, some people get diarrhea, some people get the extreme nausea, some people throw up. You are going to have a heightened sense of smell. Things are going to taste different. You might have some cravings. Just that first trimester, you're kind of in survival mode and everything's happening on the inside, but you're not seeing a huge change on the outside yet. So the second trimester is when you start seeing changes on the outside. You start getting that belly, you start showing more. And that's mostly for first pregnancies. With second pregnancies, you typically start to show a little bit sooner. So second trimester is actually what they call the honeymoon phase of a pregnancy, where you're supposed to feel your best. You're not so big yet that you're too uncomfortable, but you start having more energy. You're getting really excited. Second trimester, you might start having more questions because you might be starting to feel the baby kick, or you're Googling, when am I supposed to feel the baby kick? Oh, I haven't felt the baby yet. Is this okay? What's going on? And you go down these Googling paths. Even for me as a doula, I'm like, I have studied all of this. And in my pregnancy, I found myself constantly being like, is this normal? Is this okay? Because all of a sudden I'm experiencing it now. So, yeah, you're going to start kind of getting those exciting changes with showing, feeling the baby. The third trimester, again, is really different for everybody. You start getting, especially like those last 6 to 8 weeks, just more uncomfortable, sleeping's harder. There's certain positions you're not supposed to sleep on your back because you can clamp a nerve that actually could decrease oxygen supply to the baby. So sleeping is more difficult. You're more uncomfortable. You have to pee more. And you start getting exciting for the birth, but then also that's where a lot of fears and anxiety can come up too. So there's so much that happens physically, obviously, throughout the entire pregnancy. But I mean, each trimester is very different and going to come with its own pros and cons. But everybody's experience is also so different.
I think it's very much individualized based. I've heard people say they're almost popping the baby in the toilet before they realize they're pregnant. So it's really an individualized journey. And I love the fact when you mentioned that even though you are a doula, when you got pregnant, you still went through these emotions. You still had these feelings like what's going on. You were looking up to see, when is this going to happen? How is it going to happen? So just for moms out there, this whole talk is not anything about scaring them. It's just to let them know we all kind of go through very similar things, even though it's individualized based. Someone may not be sick throughout the whole time, while some may be sick. For myself, I wasn't too well in my first trimester, but as I moved into my second and now I'm into my third trimester, everything just seemed to be well. I'm functioning at a optimal level where I still do my work and I still do everything else, and I'm very happy about that. So it can be a little bit different for everyone, but at the same time, as soon to be mommies, we all do go through certain things which we can relate to with each other.
Yeah. Yeah, absolutely.
One of the things that happen once someone get pregnant, everybody becomes an expert besides
Right.
the person that's pregnant. The neighbor is an expert, the immediate family, the extended family, the friends, the coworkers, and no harm in this. They really really mean good. Their intentions are good. They want to give this person the best advice, what they think will work for them, or maybe something they went through and they think, okay, I did this, so maybe it'll work for you. However, as a first time mom or just being pregnant in general, like I said, we go through a lot of feelings, a lot of emotions that we're going through in that moment. So sometimes those information, we may not need some of the unsolicited information. What advice do you give to like new moms or someone who just got pregnant? How do they limit that information for themselves and just actually take what's needed?
Well, I'd say first of all, just know people are usually giving it to you because they're excited for you. They're not trying to just tell you what to do. They're genuinely excited for you, but it can still get annoying or feel overbearing. But even just like putting up boundaries, if you have that relationship, being like, just letting people know, um, hey, I'm not asking for advice. I'm just letting you know how I feel right now, or whatever it may be. But I would say to do your own research. That is so important, and to trust your gut. So we have an intuition for a reason. And some people may say, oh, well, this worked for me. Oh, I did that. Oh, you're experiencing this. You have to do that. Um, but look into it, do a little bit of research of your own, trust your gut, and decide what feels right for you. Again, that first trimester is kind of survival mode and things like that. And people might swear by different remedies that you might be open to trying, but um, you really have to figure out what works for you and just kind of and stick with it. Put up those boundaries and be like, oh, I found something that's working for me. Thank you, or whatever it may be, and just take the advice with a grain of salt. You might have people in your life that you really look up to and you value their advice, and then again, you have just the most random people telling you things and you're like, okay. um, so just, I mean, you have to figure out what works for you and just kind of stick to it and just kind of put up that bubble and not letting like any of the other advice or stuff get to you.
Absolutely. Kind of having an idea of what you would like to also experience and see through your pregnancy.
Yeah.
And like you said, they're excited for you. They want to share something that's helpful or they think that's beneficial. But again, that standard and boundary during this phase is very important, I think.
Yeah. I also feel like when it comes to your birth plan and what you're deciding on, you really have to be around people that are supportive. Um, and so if they're trying to give you advice for your delivery, or like, oh, they're like, you have to get the drugs, or oh no, you can't get any medication. Um, you really have to put that stuff out of your mind. Like you said, deciding what you want and knowing what kind of experience you want to have, even though there's a lot out of our control. Um, just kind of being like, oh, okay, like I've done a lot of research and this is where I feel comfortable, and just letting people know that, because I feel like in motherhood, that's kind of where it starts, is people saying like, oh, you can't do this, you can't do this. And you don't want to begin your motherhood journey with doubts. You really have to believe in yourself and and surround yourself with people who are going to be supporting your vision.
And I think that's part of it where it comes into when it comes to selecting someone to help you, be it your gynec or a doula, for example, knowing the person who's helping you and can provide the right type of information for one during this journey. Because all of the information, especially when it comes to that ending phase or something like that, you want to make sure that you know what exactly you would like to experience as the mom, as a soon to be mom, like what you want that pregnancy journey to be like, even at the end where you're giving birth.
Yeah, absolutely. So it is really important to have that supportive team.
We just talked about throughout the pregnancy, we have all these different little health issues that may pop up here and there. Some people don't have any. But what are some tips and advice that you would provide to moms out there on how they can take care of themselves and stay healthy and safe during this journey?
Yeah, so there's a few things that I think a lot of pregnant women don't know and probably isn't stressed enough to them. Um, and one of them is going to be the vital importance of getting protein in your diet. You're supposed to eat 70, at least 70 grams of protein a day. And 97% of moms are protein deficient and don't know it. So, whatever source of protein, even if it's drinking protein shakes or whatever it may be for you, making sure that you get enough protein is really important. Because not having enough protein can also lead to those feelings of nausea. It can lead to craving sweets and sugar and other things. But protein is very, very important. Another thing is drinking a lot of water. There's people out there that are just like, I'm not a water drinker. I don't love water. I'm sorry, but you got to. Like, you have to drink a lot of water to stay healthy during pregnancy. And I recommend at least 100 ounces a day if you can do that. So keep that water bottle full, keep going, set a reminder on your phone, whatever you can. And that even helps with staying hydrated, helps with even stretch marks or not tearing during labor and delivery because your tissues are hydrated. And so it's giving them that more elasticity to be able to move. So those two are really big. Another one is going to be trying to get most of your nutrients from your food. So taking a prenatal is necessary because none of us have perfect diets. We don't get everything we need from food sources, but you want to try to still get the majority of your nutrients from food sources. So eating a lot of dark leafy greens has folate in it, getting good protein, and making sure that you are listening to your body a little bit. Like I said, sometimes if you're having a sweet tooth, it's actually a lack of protein. And there's like a whole thing you can Google about cravings and what they actually mean. Because it's super interesting. You might be craving one thing, but it's because you're deficient in something else. So just kind of paying attention to that, and then exercising. So one of the most important things is just to keep moving, get fresh air and keep moving. I think walking is one of the most beneficial things that you can do for yourself in your pregnancy. So that helps really keep you healthy. Just getting outside, getting fresh air, going for a walk every single day, moving your body is really important. You don't have to be this like hardcore working out person. If you were before pregnancy and that still feels great for you, it's okay. But you don't have to like go run marathons while you're pregnant. Just getting out and getting fresh air and going for walks is so healthy for you. And then just avoiding the things that really aren't healthy. So obviously like drugs and smoking and things like that, but even like secondhand smoke. So this is a time when if your partner smokes, you need to tell them to quit because it is not good. And there's actually a lot of studies on how it affects the baby and the health outcomes of newborns. So avoiding those things are really, really important.
And I'm glad you're mentioning like also what to avoid, because sometimes someone may have that family member, or even like when you're walking in the community, people are just, they smoke outside, right? So being able to know, stay away from it for the baby safety, for your safety in general is very important. But most importantly, to keep yourself healthy, it means having that protein, hydrate, eating your leafy vegetables, and for physical activity, just taking some daily walks outside.
Yes. Yep. Exactly.
So something I learned about when I had my first gynec visit was they gave me a big book with stuff that I have to check out throughout each of my visit. And of course, in that excitement, I just flipped through the whole book right away. And one of the things I saw was a birth plan. So, what exactly is a birth plan? Why is it important to have one? And at what stage should a mom or with her spouse or her partner start to develop a birth plan?
Yeah, so a birth plan is going to be basically this guide that you're going to bring with you to your labor and delivery, and it's going to have the things that you want on it. So, let's say you're planning on delivering at a hospital, you want to have delayed cord clamping, you want to have intermittent monitoring, you want to be able to move freely during labor. It's going to be every single thing throughout your labor and delivery and immediate post birth. On there so that the staff knows your wishes. Um, One thing I'd like to say with birth plans is plans rarely go as we plan, especially with birth. But the importance of having a birth plan is that you learn all of your options in birthing, things that you might not even know. You might not know that you can eat and drink during labor. You don't just have to chew on ice chips anymore. And the importance of like going through and learning all this stuff is the research that you're going to do. Like, why is delayed cord clamping so beneficial? What are the risks? What are the benefits? What do I want? In case of induction, what are my options? A lot of times practices just schedule inductions and they're like, okay, we're going to induce you like this day, whatever. But you might have options in that, like as far as what is it necessary to be induced? What form of induction are we doing? Do I have a say? Like, you do have a say in that. So learning all your options in case of intervention. So if you're having even a medicated birth, in case of an epidural, what options are available to you. In case of a cesarean, what options are available to you. So it's basically you going through and deciding like every step of your birth what you want, and then if it doesn't go that way, what the alternative is and what your options are there. So it's really important because it helps you learn your rights in labor and delivery. I'm glad that you asked about when to start this, because most people kind of do the birth plan probably in the third trimester at some point. I think that it's something to look at the beginning of your birth or the beginning of your pregnancy because of a couple of options. Let's say you decide early on that you want to have a non-medicated birth and you want to be able to use hydrotherapy, which means you're going to want to get in a shower or in a tub. Well, then you have to pick a birthing place that has those options available to you. Also, if you really want to like avoid certain things, you're going to want to be with certain practices and providers. So it's important to look at your hospital statistics. What is their C-section rate? What are the birthing outcomes there? What's your provider, their C-section rate? What are their beliefs around birthing? Because research and study shows when you have that supportive staff around you, if you want an unmedicated birth, it's going to happen for you a lot more when you have doctors and nurses who are supportive of that. And there's just some practices and hospitals that really aren't. They're like, honey, just get the drugs, get the drugs. And if you're constantly hearing that when you're going through it, you're going to end up doing things that maybe you didn't want. Not that there's anything wrong with getting an epidural at all. I got an epidural at my birth. But you want to have the staff and the support that you want. I ended up getting an epidural at being in labor for over 20 hours and barely dilating and like throwing up profusely. And I had my birth plan. I had everything how I wanted it. I didn't want a medicated birth, but just the way that everything unfolded, I ended up getting one. And an hour later, I started pushing out my daughter. So, and I don't regret it because I had the support. I had I knew the information. So I felt okay with getting one. I knew that like getting an epidural wasn't going to ruin my health or my child's health, or you have to learn the risks and the benefits of every choice that you're making so that you feel informed and empowered. And my midwife and doula like were so supportive. We labored in every single position. We tried every single trick in the book for hours. And once I wanted to get the epidural, they're like, we know you want an unmedicated birth. We're going to support you either way. So we just want to make sure you're okay with this decision. And I said, yes, give it to me right now. And so I felt, I didn't look back on my birth and feel like, oh, I didn't want that. I felt pressured into it. I really wish that they would have supported me more. Like I had the ultimate support. And so it's so important to know that the provider that you're going with is going to give you the support for the birth you want. So that's why I recommend taking a look at that birth plan early, and some of the other options you can figure out a little bit later.
Guess what I hear from you also with your team is that you really felt supported all the way to the end until you decided to make that change. And that's what's really important, knowing your teams, your doctors around you, the nurses, the doula, the midwife, and making sure that they know the importance of why you want to do certain things and that they will try to support that all the way to the end. And if it all goes well in that way, that's great. But sometime here and there may be a little bit of changes and things, like you said, out of control.
Yeah. Yeah, absolutely. It's very important. And even after I made that decision, I still felt supported like until the end.
Yeah.
So, yes, it's very important.
So having the birth plan and getting to know, actually, what I like what you mentioned also in the beginning when you started talking about this was actually knowing what practices the doctors follow, the nurses follow, actually finding out these things about the hospital. I hadn't even thought about that because sometimes you feel like, oh, you have this gynaec, you're trusting them, or you have someone that you're working with. But we sometimes just going through everything because as being pregnant, you have so much that's going on. You have your regular day-to-day lifestyle that you have to take care of. And then you have all these other appointments that you have to attend and do and be a part of for the health of the baby and for yourself. Sometimes we forget these things. And I guess that's what I like when you mentioned looking at your birth plan earlier and kind of following these tips that you mentioned. So that way you set it up and you actually also know your team and who you're working with.
Yeah, exactly. Because it's hard if, like, later on in your birth, you kind of realize that your provider isn't really who you want to be birthing with. It's just like an added hassle, like switching everything, switching practices, then getting to know somebody new. But it's absolutely possible. We've had people switch the day before they delivered. I mean, it's absolutely possible, but it's just something like you were saying, like just take a look at the beginning.
Thank you. Thank you for sharing that. Since the pandemic, I have been hearing a lot more about home birth.
Mm-hmm.
So I know there's different ways you can, of course, give birth at the hospital. You can do a home birth. For someone, especially in a time like this, or just for any moms in general, when they want to figure out what type of birth they want to have, but they don't have a lot of knowledge on it besides what we're hearing, right? What's the best way for them to get the things that they're actually looking for and the support that they're looking for in making that choice, whether they want a home birth or a hospital birth, but it's still their personal choice that they're making, but getting the right kind of advice on how to do that?
Yeah, so there's one resource that I highly recommend, and that's Evidence Based Birth. They have a podcast and a website. So if you Google EBB home birth, they have a whole episode and an article on it. So you have to look at your risks and benefits of both, and only you can make that decision. I'd say you and your partner. It's really, really important for your partner to be supportive as well, because let's say you really want a home birth and your partner's not in support of that. That's just going to be like an added struggle. If you're trying to birth at home and your partner's living in fear and not support, you're more likely to end up being transferred to the hospital. So I think that it's really important to look at what the actual numbers are. And again, it kind of goes back to following your gut, following your intuition, but also knowing, like, let's say you're a high risk pregnancy, depending on what that high risk is, Like some people consider birthing over 35 high risk, which is just not true. So there's like different risks that go into it depending on. Um, so if you have an actual high risk, let's say there's something that could actually potentially go wrong, then you probably want to birth at a hospital so that you have that there. Or if during an ultrasound they discovered something with the baby that the baby might need immediate attention once they're born, you probably want to birth in a hospital. So I would say you have to, again, it goes back to just that individualized care. What are your needs? What is your risk? What does the research say? And what does my gut say? And then once you make that decision, you have to surround yourself with supportive people. So my husband and I went back and forth on whether to have a home birth or not. And when we were talking about the home birth, it was like in the middle of the pandemic. They weren't letting partners in hospitals at the time. So we were trying to figure out what was best for us. And we knew that if we made that choice, there was going to be certain people that we would just have to tell, like, listen, this is the choice that we've made. You can either support us or you can be quiet. And that's it. And you cannot invite those people to your birth. If you have, let's say, a mother or a mother-in-law who does not agree with your birth plan, do not invite them to your birth at all. You cannot have that negative energy or fear or anxiety surrounding you. You are the only person during your birth who's allowed to experience any of that. Your partner probably will too, but their job is also to be your rock, to support you and to love you through it.
No, it's important to have these information ahead of time, So you would say research, you provided a reference that they could look back at, and knowing the facts actually on both end, whether you're doing a home birth or a hospital birth. And most importantly, also in that moment and that time, having only family members or people who are supporting you there. Because it really, really does add. I mean, of course, I'm not there yet in the birthing phase, but I can tell you, even being as a professional in the field, as a clinician myself, setting that standard and boundary is one of the hardest thing you have to do. But you have to do sometimes we have to tell Ma, listen, I understand you have this many kids and you've gone through it, but things have changed 50 years later. And knowing the way how to say it, of course, to where you're not hurting the other person too much, but also making sure at the same time you're taking the stand for yourself is very, very important. Like you said, that's your moment, that's your time. And the least thing you need is someone else who's going to add some more tension while you're already going through a lot at the birth.
Mm-hmm. Yeah, absolutely. And having your partner, that's a conversation you have to have with your partner to really be your advocate as well, to support you when it comes to your family or other people. Let's say it's like their family that's saying things. It's like, listen, you need to talk to your family.
Absolutely. And I can completely relate to that. I'm from an Indian culture, and everybody has their own ways of how to do things and things like that. And this was one of the decisions my husband and I made. Of course, our baby was planned, so we knew every step and phase from the beginning until now, like how it was going. And one of the things I shared with him was in the beginning, well, you're going to have to tell your mom a little bit that I don't want to hear too much about what to do and what not to do. And I had to share the same with my mom. It's not an easy conversation to have, but it was more about what I wanted to see for my model and my practice. And as I was going through this, I wanted it to be, it was our personal choice. Again, everybody have their own choices. It was our personal choice that we wanted to experience it at a level just between him and I, and kind of make these decisions around that. As much as we welcome family decisions and advice and feedback, but we definitely had to set that standard and boundaries and that limit of how much they're sharing with us.
And that's good that you're doing that now too, because it does carry over into motherhood and the choices you're going to make for your child. You're going to have your family, like we started baby-led weaning with our daughter, which is where we're basically just giving her solids. We didn't give her any purees or anything. So she gets like whole foods. And both of our moms have freaked out about it. They're like, she can't eat that. She's going to choke. She's not going to be okay. And I'm like, listen, I took the course on it. I did the research. I whatever. This is how we're choosing to feed our daughter. And they've had a lot of opinions on it. And we've just been like, okay, that's great, but this is what we're gonna do. So you're gonna get that throughout your entire motherhood journey. So if you can
Yeah.
set those boundaries now and
Mhm.
let your family know we love you, we respect you, you did a great job at raising us,
Absolutely.
um, and we're gonna make some different decisions, and that's okay.
Things have changed. Research have changed since
Yeah.
then, and we're just going with what we see work now, and we want to try it that way because as a mom, we're also going to discover our own ways of how to raise our kids.
Oh yeah, for
Yeah.
sure.
As a doula, you mentioned you play a part in each trimester. So when it comes to the hospital or home birth, does a doula actually are they there or how does that work?
Yeah, so doulas are at the birth. So I'd say that's like our main job is to be
Okay.
at the labor and delivery. Beforehand, you're just you have a couple of meetings, you provide support through text, email, phone calls, whatever you need to talk about. But for the labor and delivery, we are the one constant that's there. So whether it's a home birth or a hospital birth, the role is the same. I would say at a hospital birth, doulas are more vital almost because your staff is going to be, they're busy. The nurses, your OB, your midwife, whoever you have at the hospital, they have other patients. They're going to be in and out of your room checking on you. Your doula is going to be there with you no matter what. Uh, with a home birth, it's your doula's gonna get there before the midwife and help you labor, help you go through things, help you get ready before the midwife comes. So there's definitely a huge role in home birth and hospital birth. And then the doula is going to be there throughout the entire labor delivery and then immediate postpartum, going to help with that initial breastfeeding, help with skin to skin, help with the recovery, usually stay for a couple of hours, making sure that you get something to eat, your partner gets something to eat, making sure you get some pictures if you want some family photos. We're not trained professional photographers, but we can snap a couple of photos for you. Actually, there's some doulas that are photographers out there, but most of us aren't. So just really helping with that initial postpartum and then having contact with you postpartum, just making sure that you're okay. So yeah, there's definitely a huge role for doulas in both hospital and home birth.
You play a big part for the mommy, but as a doula, do you play a part when it comes to any support for the partner or the family or even the team around, like, the medical professions and things like that? Are you involved in those also as a doula?
So I would say our biggest role besides the mom is going to be the partner. Uh, we give the partner a huge role. So when people say, I don't need a doula, I have my husband or my partner. And I'm like, but is your partner a labor expert? Are they going to know how to help you and what to do? And most of them don't. So where we come in is we partner with your partner to help them know how to best support you. So there's going to be times where the doula is doing a lot of physical work and the partner is going to be like there with you emotionally, or you might switch. There's actually a really interesting study that showed that births where a doula was present, the mom actually looked back and had a more favorable view of their partner's role and support at the birth because the doula gave them that role. They helped bring that partner in and showed them how to best support you throughout the experience. So I would say doulas are awesome for partners. They also give them that relief. Like your partner, like if you have a long labor, they can go get something to eat. They can make a phone call. They can check on other kids at home. They can do things that they need to do and not feel like they're leaving you alone. When it comes to the other staff around, we don't really have a role as far as like helping them at all. We don't do anything medical, but what we do is help interpret information. So if the doctor's saying, hey, listen, this is how much you've progressed. I really feel like, we should put you on Pitocin, we should whatever. The doula then is going to, usually say, can we have some time to think about it? And then talk to you so that you feel informed, that you know, like, what are my risks? What are my benefits? What what can we ask the doctor to do besides that? What if we have more time? And help you come up with questions to ask your OB in that moment so that you're feeling informed and empowered throughout the experience. So how we basically come in our role with staff is just going to be helping interpret the data, and then also helping remind staff of your birthing preferences. If they're like, hey, we're going to go ahead and once the baby's born, we're going to grab the baby, wipe them down, and weigh and measure them, being like, she'd really like you to put the baby immediately on skin to skin and give them that hour alone without any interventions. So just helping remind the staff and then helping interpret data.
Clarity, I guess. Clarity is one of the most important part in that time. The mom is going through pain. They're going through everything as is when they're trying to give birth. And as you said, even someone as an expert, even if somebody is, like a doula that's giving birth, or a doctor, in that moment when I'm thinking, when someone is going through all of this, clarity can get a little bit fumbly. So, and same thing for the partner, because the emotion is involved with, I love my partner, what to do, and they're feeling frustrated at the same time. But it seems like having that doula, that person is there sound with clarity, and they know this birth plan, they know what this person would want, and they're there to help initiate that or give that partner that break that he or she may need, or talk to that professional, hey, this is what this person actually want. Maybe they forgot completely about it, but this is what they wanted. So you bring in clarity in that situation.
Right. Yep.
Part of it that we touched bases on earlier was professionals and selecting people that support you. So when it comes to selecting a doula, what are some of the things one should look for? For example, for myself and my practice in general in life, in my professional life, in my personal life, I'm a strength-based person. There are people who can be fear-based. And I'm not, if I go to a medical profession, and for example, when I was in my first trimester, I remember the first phone call I had with one of the medical profession, it came out very fear-based. And the first thing they talked about was medication and all these things. Hence, I don't have anything against medication. However, it didn't feel comfortable that I think it was under 60 seconds that I spoke to this person about how I felt. So they barely got my name, and that, hey, I'm feeling a bit sick, and the next thing was just try this, take this, we got to order this for you to pick up and drink. And it felt a bit more of something that I wasn't looking for. So I realized immediately that I need to get online, look up all the professionals that work at the hospital. What's their model? What's their practice? Because I was looking for somebody who's more strength based. Luckily, that was very easily taken care of. And I still remember my second appointment with the new professional. She immediately, the first thing she did after I shared with her what I was going to, like, let me tell you this, that is normal. Be happy that you're going through it. And actually, what I learned, that even though I was feeling that ill, it was actually in a sense that I may have less chances of having a miscarriage.
Right.
I naturally felt like, you know what, if I have to be ill like this for the rest of the time, I'll do it to make sure that my baby is safe. But it really depends for me if somebody is strength based, and also finding out their model, their practice, and how they do things. So when it comes to selecting a doula, what's your feedback and tips for moms?
Yeah. So there's a few things that go into selecting a doula, and I would say um, a big thing is to get a referral. So if you know someone who used a doula and loved it, get a referral. Same with any providers, right? Get a referral. So talk to your friends. Did you use a doula? Who did you go through? What was your experience? Next is going to be your price point, because a lot of insurance companies don't cover doulas. So what can you afford? So looking on places like Doula Match, you might be able to find somebody within your price range, or going to a website like Dona International. You can look if there's some in your area and see what their price points are, and seeing what you can afford. I'd say asking them what their birthing philosophy is. You want to select somebody who makes it all about you and not about them. So if you're going to ask me, what's your birthing philosophy? And I'm like, oh, I believe that birth is supernatural and you need to just let your body experience whatever. You might be like, okay, well, I'm actually planning on getting an epidural. So not, um, this is not the person that, that I want to birth with if they're not in alignment with your plan. So I think asking them what their birthing philosophy is and interviewing them, and interview a few people and see who you have that best bond with.
So talking to a few people before making that choice, that decision. Yeah. First of all, Liz, I want to thank you so much for being here today once again. You have dropped some amazing gem. I think we have learned what a doula is, a doula role throughout the pregnancy, and not only that, what moms go through in first, second, and third trimester, how to stay healthy, how to stay safe, how to take care of yourself, how to look at research. There's so much that you shared with us. However, I think there's always someone out there who would want to learn more, or they just wanted to find out how to get in contact with you and reach out to you. So, what are some ways if someone wanted to get in touch with you as a doula?
Yeah, of course. So you can email me at elizabeth@elizabethjoy.co. And that's probably the best way to reach me. I also have a website, miraculousmamas.com. I have a podcast called Miraculous Mamas where we talk about all of this stuff. And my Instagram, the Miraculous Mamas podcast, is on there as well. So I would say, yeah, the email is probably the best way. But if you just kind of want to learn more about different topics when it comes to birthing and pregnancy, the podcast is a great resource as well. And thank you so much for having me. It was such a great conversation, and I love talking about everything birth and pregnancy.
Yeah. Thank you. Thank you again. I know I have learned so much from you just from this talk. So thanks again for being here. Don't forget, guys, if you like this video, don't forget to hit the like, subscribe, comment button below, and I'll see you all in the next video. Bye for now.